I've been a pescatarian for 28 years. Do you suggest I start eating meat, and should I do that gradually or quickly? Nope. Stick with your pescatarian, my dear. You're fine. Miss the Nest. Hello. Capture Dace. Cool. Hi, folks. I hope you're seeing me on Facebook Live and YouTube. I was prescribed letrozole for an upcoming modified natural FET, but I ovulated on my own. Is it really needed? No. If you ovulate on your own, but it's uncontrolled, therefore untimed. Hello, Amanda. Thank you for telling me I'm back. Vanessa's jumping right in, always jumps right in. We're back. I apologize if you already answered this question with the video froze, but is it safe to use Provera to induce my period so that I can start IUI? I will be using injectable meds. Yeah, you can, Brianna, as long as you have a negative pregnancy test. How many failed transfers, miscarriages? Would you recommend transferring 2 embryos, 32 years old, have had a laparoscopy to remove fentanyl and polyps? It depends on, are they day 3, day 5? Are they tested? Hey, Dr. Mag, I'm 22. I'm only 5. I'm on day 5 of stims for IVF. I have about 40 follicles on each ovary, but only 3 follicles bigger than 13 mil. Is this normal? Yes, but be careful for ovarian hyperstimulation. How long after preconception testing does your IVF start? COIA. Probably about 6 weeks. Day 5 untested, 35 years old. I think if it's your first time, put 1 in. If it's your second time, put 2. That's not unreasonable. Hello, Dr. Mag. Does endometriosis cause implantation failures? It can. How soon after consultation can you start IVF? Usually within 3 months. Does endometrioma affect success rates? Yes, it does. You suggested lap histo, but do you recommend before the surgery or after IVF retrieval? Definitely get your eggs, make your embryos. Brenda, hello. Nice. Hi. Can you explain the process of IVF for a gay male? Well, essentially, you provide the sperm. Then you have to get donor eggs. You have to get a gestational carrier. So you get donor eggs and you fertilize the eggs, make embryos. Then you get a gestational carrier, and the gestational carrier will carry the embryos. So really, you provide sperm. Patricia, I'm feeling much better today. Good. Kaylee Kelly, how does Oralisa work? It's a sort of a down regulator for FSH and LH, and it reduces that stimulation for estrogen production, which in turn can reduce the negative effects of endometriosis. How does endometriosis affect transfer rates? Well, it does affect it. What all do you offer? We offer everything for the gay male, gay female, single, transgender, heterosexual couples. Nabob, I had endometrial tissue removed in 2020. How quickly can it come back? How often should I be checked for it? Well, it can be 6 months is certainly reasonable to recheck. Is there any way to help adenomyosis? It helps implantation to help with success. Yes, you could be on prolonged Lupron therapy, about 3 months. You can do acupuncture with herbs. When do you recommend letrozole on stims, and when do you choose not to use it? I don't recommend letrozole generally. I do recommend it for the mini IVF just to save money. The only reason is to save money. What is Omnitrope? It's a growth hormone. Can IVF be done with bilateral hydrosalpinx? It can, but before you put the embryo back in, you want to have that hydrosalpinx fixed. Diha, after 4 failed transfers, what would you suggest for the next transfer? We'll be doing good. Do hysteroscopy, do an ERA. Those are 2 big things. Do add acupuncture. Is a fresh transfer better than frozen for someone in my age range, 22? I really would like to do fresh after my retrieval, Victoria. Well, aren't you the one with the 80 follicles? So it's not likely you're going to be doing fresh. You'll be frozen and it's better for you. Scylla, 29-year-old, tubes tied. I have a pelvic congestion syndrome. Should I do tubal reversal or IVF? IVF. What is the test for information for EMB, ERA? Will it show if endometrial biopsy? What is the test for inflammation with EMB? Don't know. I don't know what that question is. Sorry. I've had a series of very stressful events this week, which concluded having to move a few pretty heavy items. Have I completely blown this transfer? Absolutely not. Absolutely not. Remember, pregnancy is a natural state, not ERA receptivity. Oh, ERA, endometrial receptivity assay, is a test of the uterine lining to coordinate implantation with the implantation window. Sherry Sawyer. Hi, Dr. Mag. I had my first failed FET. We transferred a 3.7 and a 3.6. We have a 3.9 donor egg embryo and 2.8 and 1.8 embryos made from my eggs. Would you suggest transferring all three? No. Is estrase better absorbed orally? Vaginally, everything is absorbed better, to be honest with you. What do you think gets better outcomes for diminished ovarian reserved and over 40? Conventional or ICSI? ICSI. That's what I think. Although the data doesn't support that, it's what I think. You're welcome, Sherry. I would do 2, Sherry. And I don't know how old you are, but I would do 2, and I would separate the donor egg from your own eggs. AMH 0.3, you recommend IUI or IVF after age 41? Well, there's no difference with IUI and sex, so I would say do sex or IVF. But doing IUI at age 41, that's really not going to be that helpful. And Sherry, you're 42, definitely put 2 in. Again, I try not to combine donor egg embryos with your own egg embryos, mainly so that you know who the parents are. And also, you don't have the potential of one miscarriage causing a problem. I'm 39, premenopausal. Do you recommend fresh or frozen eggs? Fresh. The reason fresh is you're not going to have a lot of eggs. Should I do an X-ray, XHG, even if it's better to do IVF? Those are not related, Scylla. I would do hysteroscopy for IVF. That's what I would do. Is a fresh transfer better for someone that is younger than me, 22? I would really like to do fresh transfer after my retrieval. It has nothing to do with your age, Victoria. It has to do with the number of eggs you make. And if you have hyperstimulation, then frozen it is. After 4 failed transfers, what would you suggest for the next transfer to be doing? I already answered that, DJ. Celeste, hi, Dr. Mag. I was told that once I remove my tubes, my AMH will go down. 39 years old. Can you explain this to me, why it reduces? Yes, poor blood flow. I'm 29, unexplained infertility, 1 IVF. What's the next step? Another IVF. I had a successful FET and I have 1-year-old. I just did another FET with 2 embryos and miscarriage. Should I change my protocol? No. It's not a protocol issue. It's an embryo issue. Protocols, yeah, I understand. It's a word. It's a word. Yeah, I had 2 miscarriages and naturally pregnant. Don't know what that is. Victoria, of course, you're welcome. Okay. Ahem. 33, AMH 1.5. Always any way to know how many eggs I would get during a retrieval? 33, 1.5, probably 8 to 10 eggs is my guess, but it's only a guess. Each person is unique. All right, Facebook folks and YouTube folks, ask some questions. Age 24 with an AMH of 7, does that mean PCOS? Yes. Can low vitamin D cause recurrent miscarriages? My understanding is it reduces fertility. Whether or not it's miscarriage is not sure, but it is related to lower fertility or lower birth outcomes. It is related. What does 7DP5DT mean, Carissa? Don't know what that means. Jackie, anything I can do to keep my estrogen levels below 2,500 during stims to be able to do a fresh transfer? Well, don't grow eggs. And of course, you don't want to do that. It's all about the eggs. So more eggs, more embryos, better chance. So lower the doses can be one thing. Mrs. Nadine Jones, I'm on thyroid medicine for low thyroid. Will that affect anything with my FET? Yeah, it'll improve you. Improve your chances. Hello, Scooby. Hello. Jennifer, age 38, AMH of 2.17. Is that good? Yes, it is. Would you recommend an ERA after a failed transfer? Yes. We'll have to do another egg retrieval before doing another transfer. After IUI that ended in ectopic, do you have any recommendations? Should you try IUI again? Sure. Why is there a 3-month gap of time between initial consultation and starting IVF? 8,000 phone calls a day, 20,000 people ask us for help every month. You can do the math. What are pros and cons of ICSI? More eggs, more embryos, fewer unfertilized, fewer polyspermia. Some people suggest there may be a negative to ICSI. I'm not sure that's true. Do you help overweight girl go through fertility? We don't judge people by their weight. Carrie, is it possible to increase motility and morphology from my husband's sperm? He's on constant Clomid currently. Not. Well, I'll try acupuncture. I had a successful transfer after an ERA. Baby is 1. 2 failed transfers from same paper protocol tested embryos. I have 1 embryo left. Do you need to change anything? Maybe to do a natural cycle versus medicated? Sure, that's an option. 40-year-old PCOS, first IVF resulted in 1 average blast that failed. Had all tests done prior to ERA, history receptive, and also did implantation protocol. Does this sound like an egg issue? At 40, it's by definition an egg issue. That doesn't mean you can't make a baby, but it is an egg issue. Successful rate of transferring a segmental abnormal embryo, it's about 50% less than whatever your age is. Maybe 70% less. What if you have an ovary that is hard to maneuver during egg retrieval? Do you do a transabdominal aspiration? Yes, we can. What is the difference between IVF and ICSI? There's no difference. They're unrelated. IVF is stimulating to get eggs. ICSI is to fertilize the egg. Oh, basic IVF is where you don't fertilize the egg one at a time. I think that's what you mean. And you just put the sperm and the egg in a dish. Do people with PCOS have a lower egg quality or embryo quality? They tend to. Not a lot, but they tend to. Kids send too quick. I have some light brown spotting today, and yesterday I had my transfer Tuesday. Do you think this could be my implantation? Sure. I've had 4 positive home tests, so I'm afraid about the spotting. Well, keep yourself well hydrated. Are success rates better with natural transfer or medicated? I'm working on that. I'm not sure. I had 2 embryos transferred today. One was that and that. What does that mean? That's just the grading. My vitamin D level is 42. It says I'm deficient. How much vitamin D should I take? Well, I take about 5,000 international units a day regularly. Hi, Doc. I did my beta yesterday. I ran out negative, but do you recommend I add on in my next cycle or get better results for my next cycle as I wait? I don't know what that means. Sorry. Make your questions a little clearer. Will you be while you are searching for an egg donor, should you start a protocol? Vitamins, absolutely. Please download our family building guide. Get started on Vital. Get started on acupuncture. Those are all the things that you can do. And honestly, they're worth doing. They really are. Hey, Dr. Mag, thanks for doing these. Can't wait to see you in June. Okay, it's Michael and Casey Batchman. My pleasure. My fallopian tube is blocked and I'm 39. Are there chances of getting a baby? Yes, IVF. That's what it was made for. It was literally made for that. Okay. Hi, Unique. Hello, Amanda. Hello, Luxalicious. La Teatra. What can I do to prepare for my IVF now? I have a consultation with you in May. I'm 48, planning for a 4th child. Acupuncture, Vital. Download the family building guide, follow it, avoid alcohol, tobacco, drugs. How soon can you take a home test after transfer to see if it worked? We don't recommend it, but 2 weeks at least. Are you able to use anesthesia on me for transfer? I have vaginismus, and even a normal PAP is uncomfortable for me. And when I had my HSC, they couldn't even get a catheter in me. Is there any? Yes, of course. Just has to be put under anesthesia for your transfer. Do you see more success with fresh or frozen transfers? Yes. In other words, I see success with both. They're both the same. What's better for stims, Amenopur or ACGLH? No one in particular. Recommend transfer protocol for a person with hyperthyroidism. No such thing. There are no protocols for hyperthyroidism. It's just the same as everybody else. What do you recommend to do before frozen embryo transfer? Download the family building guide, acupuncture, Vital. If you can get on growth hormone, that's great. How soon after a tubal reversal can you have an HSG? I would imagine 4 to 6 weeks. Can you talk about one would use Clomid over letrozole? Well, Clomid has more side effects. I don't use it. Letrozole has fewer. Clomid can cause the opposite effect, act as a contraception. Letrozole can't. Clomid is multifollicular development. Letrozole is monofollicular development. So better, better, better. Amanda, J. Lewis Hassler. The first number is, oh, there you go. Thank you. Amanda, you're wonderful. Yep, is the grade, and the second number is the number of cells. So there you go. So 1 is a poor, 2 is a fair, 3, 4 is good. And then, of course, the number of cells, 8 cells, 6 cells, 5 cells. Thank you. If I am sick after a transfer, should I contact CNY or a primary doctor? Primary. It depends on what kind of sick you are. You can contact both. What should I take to have high fertility? Don't know. Don't know what you mean, high fertility. Yeah, I don't know what that means. Is there another medication to help stimulate follicles other than letrozole? Absolutely. There's gonadotropins, Gonal-F, Follistim, Menopur. There's Clomid, clomiphene citrate, lots of things. Okay. Shawnee has joined us. Welcome, Shawnee. Amanda, you're wonderful. Thank you for sending that stuff. Is there anything that can be done to improve egg quality? Well, acupuncture, serovital, growth hormone, avoiding insulinogenic foods like high carbs, so do a low carb diet. If you have Hashimoto's, what immune protocol do you recommend? I recommend you take Synthroid or levothyroxine or MP thyroid. Make sure you do that. There's no immune protocol for that. What percentage chance does a 4BB embryo have? Depends on the age. Can serovital help frozen embryo transfer, or is it mostly for? No, it's serovital is a growth hormone secretagogue that helps sperm, it helps eggs, it helps the uterus. So yeah, so you use it for all those wonderful things. Okay, that's what I recommend. Let's see what we got going here. Okay. Put that down there a little bit. Is that working? Yeah, okay. I think it's working. Or have you seen a fair amount of day 5 4BB embryos make it? Yes. What do you think of the supplements called Conception? Yeah, why not? Explain receptiva biopsy. Okay, so it's just a tissue sample. They look for markers for inflammation in the pelvis that is associated with endometriosis. It's not the same. Should my husband also take serovital? Absolutely. If a person does not have their fallopian tubes anymore, would they qualify for mini IVF? It has nothing to do with that. If you don't have fertility problems, don't know what your question is. What is good for secondary infertility? What can be taken to increase chances for a successful IVF cycle? Vitamins. Download our family building guide. Low carb eating. Serovital. Multi-nutrients. Acupuncture. Is there an immune protocol for using donor eggs? Nope. What do you guys do for chronic endometritis? Yes, you can use we have an antibiotic protocol for chronic endometritis. I'm 43, low AMH, looking to do IVF end of this month. Since I'm averaging 2 to 3 follicles a cycle, should I do multiple retrievals before doing the IVF for transfer process? Yes. If you don't have fertility problems, if you don't have your cycle, I'm Isa. I'm not following your question. I'm not following your question there. Hi, Shawnee. I'm 38, block tubes, great uterus with lots of eggs for my age 30 to be exact. What's the possibility of fertilization? Excellent. Do you have a better chance if you test the embryos of getting pregnant? Yes. Hubby has less than 1,000 sperm. Is that enough for IVF? Yes. Hi, Karen Harris. Hi, Amy. If you don't have, yes. Dr. Mag, you're wonderful. Thank you, Jennifer. That's sweet of you to say. Thank you for being on here. Just keep asking questions. Hi, Doctor. Hi, Karen Harris. Welcome. Mars IG, Safez, hello. Hello. All these wonderful people are joining. Thank you for joining. Can antibiotics treat a hydrosalpinx? Not likely. That's usually surgically treated. What would constitute the mini IVF cycle protocol? That would mean 200 international units of Gonalef or Follistim, 10 units of HCG-LH, letrozole lead-in, and HCG 10,000 for trigger. That's a protocol. That's just the way we do it. It just means less medications, less eggs. Lady Hawk, any thoughts on what can help naturally lower TSH levels? No. What is the possibility of twins during a transfer? It depends on how many embryos are transferred and depends on whether they're tested or not. Thank you, Patricia. Using donor sperm and starting IVF in September. My AMH is 14. Is that good? Amanda Rivera, be very careful of ovarian hyperstimulation. Please keep telling people your AMH is 14. My AMH is 14. Joy, I currently weigh 230. What chances of weight loss would help? What amount of weight loss? 10% of here's the cool thing with weight loss. If you lose 10% of your body weight, regardless of where you start, you can be improved. What does Immune Protocol 2 mean? Download our family building guide. It's listed in there. Can you share about PGD testing and who it benefits and who it may not? It benefits those with the genetic problem. It benefits those who want boys or girls. It benefits those who are between 35 and 40. It benefits those who have recurrent pregnancy loss. Those are the main ones. Karen, I'm in Tennessee. Well, I'm actually going to be out in Tennessee at Chattanooga next week doing the Ironman 70.3 with my wife is running that race, the Ironman 70.3 in Chattanooga, Tennessee. Any ideas of what to do in Chattanooga? Okay, Rose, can I go straight to work same day after HSG? Yes. Jessica, 41, high BMI, ultrasound after 6 days of stimming showed 10 follicles on Immune Protocol and 450 of that. Will follicles likely to start growing? Jessica, ask the team if you can use your injections in your deltoid. Anyone with a high BMI, please ask if you can get your injections in a deltoid. It'll save you a lot of money. Hello, Shelly Bell. Are you okay transferring abnormals? Yes, I'm okay. Does your clinic allow for more than one embryo transfer at a time? In some circumstances, we do. My last FET, I never got a trilaminar uterine lining, but the doctor urged me to transfer anyways. It was my only embryo which failed. Do you think the trilaminar lining is important? Yes. I am currently awaiting a consult to transfer my care to CNY. So Jennifer, yes, I do think it's important. But again, everything is it's hard to say definitively why it didn't work. Stephanie, Serovital Advanced, no. Original Serovital. Original Serovital. Original, don't use the Advanced. It has caffeine. Let's see. 37-year-old, 4 failed IVF cycles, 1 successful miscarriage at 7 weeks, and 2 embryos left. What now? Well, do an So you had a miscarriage, so you had implantation. Make sure you have a current hysteroscopy, acupuncture, Serovital, HCG wash, intralipids, possibly even a PRP wash. How long does and by the way, for the lady who didn't have trilamina, Jennifer, consider a PRP wash 2 or 3 months. How long does HCG stay in your body? About 48 to 72 hours. So you got to be careful when you do pregnancy tests after taking a shot. It has a long half-life. Do I suggest HCG boosters for fresh transfers? Certainly. Is there a possible? Now we're going. How long before your cycle should I start Serovital? Immediately. 43-year-old transferred embryos with proven donor all failed. Have you been pregnant off IUI at age 40 that miscarried? Okay. Well, I have a lot of thoughts. It's not clear though. Deep Power 28, Journey to Baby 1. Hello. What is human growth hormone used for in FET? Do you recommend it? I do, because it affects the uterine quality of the cells, blood vessels, the whole system. Sherry Rick Quell Rice, intralipids. See different information regarding weekly versus monthly after positive test. Is there harm doing less than weekly? Also, is the glycerin harmful in intralipids since it's not recommended to use cosmetics with glycerin? I don't have a clue with any of your questions, Sherry Lynn. I don't know the answer to that. What does your clinic recommend meds like Claritin for? Why do we do that? That's an antihistamine, and there were some studies out of CCRM that suggested that might help implantation. So we kind of add stuff that helps implantation. Is it normal to have slower growing follicles? Second retrieval and follicles are growing slow. Well, make sure you're getting the medications. If you need to get it in your deltoid, get it in your deltoid. Shell Bell, okay, thank you. I will ask for it. I had an ERA April 15th, so now we know how much progesterone I need. Good. That's what it's for. Why do people send me a request to be in your live video? I don't understand that. But maybe I just don't understand that. What facility are you out of? I'm in CNY, Colorado. So I'm in Colorado Springs. If I have any consult, if I have my consult with a PA, can we choose the doctor we want to do the procedure? Of course. Will you have a different protocol than her with my consult? No. If you get a positive test after transfer, when do you normally wean off prednisone? Talk to your nurses. They have a whole protocol for that. How often do you suggest intralipid infusions after a positive? My understanding is like once a week, but again, I would look it up on the Family Building Guide. I'm on day 2 of meds, IUI, FSH of 14. If so, can I lower it? No. No, the FSH of 14 means you have low ovarian reserve. It does not mean you have an abnormal one. So first transfer was in March, failed Navy transfer is scheduled for Saturday. Didn't do intralipids, only thing. Okay. I've been using Gonalef and low-dose HCG in arm. Good. Last IUI cycle with injectables was canceled due to my poor response. Worried the same for my IVF cycle. Would you expect to see some growth after 6 days of sim? I would. Any recommendations for Hashimoto's? Will antihistamines help that? No, but definitely take your thyroid medicine. What do you think about embryos with XXX, doctor? I don't even know what that means, Karen Harris. What do you think? Oh, about embryos who are abnormal embryos, which are I wouldn't transfer it. When do you stop HGH Omni during an IVF cycle? You don't. Keep going, even into the transfer. Is an AMH of 6 good? Yes, it's very good. It's not too high. It is high, but it's relative high. So more eggs, it means more eggs, more embryos, better chance of success. Okay. We're cooking now. So I'm Dr. Magarelli, CNY Fertility, Colorado. Thank you, by the way, to the HR folks for coming out to visit us, to say hi, meet all my staff. They said you were great staff, and I believe that. Didn't need them to tell me, but I'm nice to hear. I'm really proud of my staff here at the Colorado's CNY Fertility. We have a strong, well-trained, educated, good folks, good sense of humor, hardworking. So when you come out, say hi to everybody. Can you take birth control pills a month before FET if you have inflammation from endometriosis? Well, yeah, the inflammation is an interesting word, but the bottom line is it may help with implantation. Is it normal to be extremely tired the day after transfer with tiny cramps? Yes, it is, but make sure you keep yourself well hydrated. So again, I haven't gotten an answer why people asked to be in this live video. Don't know why. Does anybody know why people asked to be in the video, or is that just what people do? Amy, I was put on 1,500 milligrams of metformin because my AMH was 6.3. Do you agree with metformin? No. Finally, had my consult this month. I have PCOS and my husband has abnormal shape. What of sperm? What type of procedure could possibly work for us? IVF with ICSI? I was told to try Plaquenil instead of Prograf because of newly diagnosed Hashimoto's. I had a successful transfer with Prograf. Why would Plaquenil be better? I did not recommend it. Ignore it, doctor. Karen, I'm not quite sure what you mean. Ignore it, doctor. Okay. They just wanted to be seen. Oh, I see. Thank you. Oh, thank you. Ignore these people who want to be on my live. Got it. Thank you. They want to talk to me live. Got it. Thank you so much. Rebecca. Oh, hi, Rebecca. I'm 7 weeks along after my retrieval with you and transfer with Dr. Fink. Grateful for the whole team. It is my pleasure, Rebecca. I am so happy to hear that. They just want to be in your live video and share a screen with them so we can see them. Nah. What can cause the follicle count to jump up? I went from 4 to over 15 in 2 years. Don't. I think it's just a matter of when you were looking at it or that particular cycle. Thank you, Shelly Bell. I'm 39, high BMI with endometriosis, first IVF temp using Gonal-F and Menopur. Tomorrow's ultrasound will determine trigger time for HEG. This is the first I'm hearing about Gonal-F in the arm. Well, if you're getting a good response, Nikki, then no worries. And Menopur, Gonal-F, yeah. In other words, if you have a high body mass index, it means you have a lot of fat typically, and that fat doesn't absorb the medicine very well. So when the deltoid is really easy, right? Easy to see the muscle, right? You can easily see the muscle, so you can easily get in to that part of the medicine inside the muscle, which is really where you want it. Are all meds required when doing IVF? Yes. Or only PIO after transfer? No, all the medicines are the medicines. They ask to go live with him so they can ask questions and make sure they get the answers they need. And if they don't understand the answer, you can give them and ask the question in a different way. Well, Joey, yeah, I'd love to do that, but I really can't. AMH of 0.03. Can I use my own eggs? You can try, but I would have a donor egg backup. What is the protocol for meds for women that all numbers are normal but doing IVF for male fertility? Well, it has to do with your age, Brandy, and it has to do with your AMH, and it has to do with your history. So the amount of medicine, that's what's called the protocol, guys. It's the amount of medicine in a certain fashion. It's a style of dress, okay? But it's still a dress. Whether it's a polka dot or stripes, we're calling them protocols, but they're just styles of managing patients' growth, okay? Is there a possibility that during IVF, the body attacks the embryo? If so, what protocol can you take to avoid this? The body attacks the embryo. Don't know that one. Sorry, I don't know that one. Alrighty. I'm not sure what you're asking about the body attacking the embryo. You mean just not being successful? That happens most of the time. Is high dose Gonal-F recommended for only one ovary? No, it has to do with your age, your AMH, because that's what it has to do with, not whether you have one or two ovaries. Yeah. Oh, that's natural killer cells is what you're talking about. So if that's what you mean, there are protocols to manage natural killer cells if that's the reason. But remember, natural killer cells are positive. They're not negative. See, that's the thing. Yes, during reciprocal IVF. There are protocols to help with that. Can AMH be increased with supplements? No. Do you recommend PGC testing when using donor eggs? No. Do you recommend myomectomy for uterine fibroids greater than 7 centimeters located outside of the uterus prior to transfer? No, Gina. Can you do an FET for baby number 2 without using all the meds? No. That's like saying, can you cook a cake without the ingredients? No. The fact that you were pregnant is great. Will CMY test for natural killer cells? I think there are companies that do it. We don't have internal companies to do it, but there are external companies that can test for natural killer cells. All righty. Beyonce, 96 joins. Hello, my dear. Do you prefer frozen or fresh personally, or does it differ for every case? It differs for every case. To give you an idea, if you have hyperstimulation, of course, you want to do a frozen embryo transfer. If you have low ovarian reserve, you may want to do a fresh ovarian transfer. If you're in the middle, you're in the middle. So the worst thing to do is what your girlfriend did to get pregnant. I hear this all the time. My girlfriend did X. I want to do it. That's not medicine. Do day 7 euploids have a good chance of implantation? Yes. Counseling escape room. How do you do counseling escape room? Well, welcome, counseling escape room. Huh. Hello. So euploids just mean normal embryos. So normal embryos. Can frozen embryos be tested after they have been frozen? Yes, they can. Hi, Claudia. You're joining late. We're almost over here, Claudia. We start at 4 p.m. Central, not 5. Perfectly imperfect. I'm excited to start my journey with CNY in July. Yay. We're happy too. Let's see what's going on here on the Facebook Live and YouTube Live. Not much. Not much going on that side. Questions, guys. Oh, Karen, you're so welcome. Caroline, you are so welcome. What is good estradiol and progesterone levels for FET I transferred today? Good. Progesterone over 20 is we use, but 10 is fine. And estrogen over 100 and any number is fine. Chell Bell, we love you too. How are eggs retrieved? Are you sedated? Yes, Mary. You 11 days of medications. Then we place the needle through the wall of the vagina. The ovaries fall right next to the vagina. You don't need fallopian tubes. You don't need a uterus. We then take the eggs out directly. It takes about 5 minutes. Can you freeze eggs after 40? You can, but you got to freeze a lot. Is there such a thing as too much folic acid in a prenatal? There's some suggestion, but if you have the right tetrahydrofolate, then yes. The CYN do payment plans. We do for FET cycles. I think we do it for just about everything. Do you prefer day 3 or day 5 embryos? It depends on the person and their history and how many embryos they have. What does the saline sonogram look for? Masses inside the uterus that can interfere with implantation. Do you have a preference for priming? Well, the priming that I think about is growth hormone, serovital, acupuncture, and sometimes estrays. Those are, by priming, it's like getting things juicy. That's what you're doing. And like in an engine, you prime the pump with gasoline to get it started. With priming in humans, you add growth hormone. Serovital adds more growth hormone. Estrays adds estrogen, which juices things up. That's the stuff. Now, progesterone is a safety thing, but the rest are really the primers. I transferred on Monday. I'm scheduled for acupuncture before FET. Do you think afterwards will also help? Yes, Lindsay. The studies look at pre and post, not just pre. When and how often do you recommend acupuncture? There's 9 treatments before the retrieval and in a fresh cycle, and then 1 pre and post the transfer. In a frozen cycle, there's 8 treatments before the transfer. So I think I just answered that question. How important is it to take prednisone for FET and what role does it play? Well, it's an anti-inflammatory. I have trouble tolerating it. Don't take it. What's an ideal estrogen and progesterone level at the day of transfer? I think you asked this already. It's not ideal. You need the progesterone above 10, and you need the estrogen around 100. That's approximate. Do you prefer Serovital over Omni? No, I think I prefer both. By the way, Serovital is very inexpensive, and please get the original one, not the advanced one. My first time here, how do I get started for IVF? You create an appointment with CNY Fertility. You can go right now and download the Family Building Guide. Doctors, you all are a blessing in my life. So excited to go to New York and start my FET. Thank you, Karen. Angelica, how important is it to take prednisone? I already answered that. Sands Bell, the Forever Law, and Anna Flax, we are about to end the Facebook Live. So we start at 4 p.m. on Mountain Time on Tuesdays, not 5. My E2 was 144. My P4 was 45. I transferred to Colorado today. Euploid tested 5AA. Are those good? Those are great, Lacey. What do antihistamines do? Reduce the histamine response, which may contribute to implantation issues. If I don't ovulate and have had losses with PGTA embryos, should I backtrack to IUI? Nope. You should figure out what's going on with your uterus. It has nothing to do with the IUI or IVF. Something's going on there. You may need a gestational carrier, Michelle. Can you do IVF when you're pre-menopausal? Yes, you can. What symptoms should I have? 10. Don't know. What symptoms should I have 10? I don't know what 10 is. Sorry. If not in the U.S. and can be treated by your best thing to look at when choosing a clinic for freezing eggs. Don't know what that means. Sorry. If not in the U.S., don't know. Have a history of cervical cerclage done with previous pregnancy. Would that interfere with the transfer? It could. So make sure you do a trial transfer. What does Serovital do? It creates growth hormone precursors in the body, which in turn elevates the growth hormone levels. I'm having trouble following pills. Do you recommend gummies? Sure. 10-DPT. 10-DPT. I don't know what that is. Sorry. Can you do IVF while premenopausal? Yes. Symptoms 10 days after IVF transfer. But what's the question in the Forever Law? I'm not sure your question. 10 days post-transfer and symptoms. Yeah, thank you, Jennifer. But I'm not sure what the question is. At what age do you recommend patients not using their own eggs? Up to what age? Well, it's not an age thing. It's an egg thing. Is CBD oil recommended for FET? I do not recommend it. I'm not against it, but I don't recommend it. Serovital multivitamin pack for women? Nope. It's just Serovital. The original Serovital. Go to Costco. They sell it at Costco. Very inexpensive. Now, AMH is a reason to help you predict whether or not someone's going to have enough eggs to make a baby. Age is another reason. So that's when you decide to do a donor. What symptoms should I have 10 days after IVF transfer? None. Do you have a donor database with generous database of persons of color? I have no idea. I don't know what a generous database means. But I would just go to the databases anywhere in the country. What do you recommend for your first FET? Well, the Family Building Guide. Just FYI, it's on sale. Serovital, the basic, is on sale at Costco, so run on it. What's a good MAH? I have 2.85. That's a great AMH. Still producing my own eggs and will be 45, producing AXP7 each cycle. Approximately, I think what you mean. That's great, boss lady. That's very, very nice. All right, so we're winding down. What time is it? It's got 4 minutes. I'm a low ovarian reserve on 375 and 20. First monitoring appointment shows follicle at 15 to as of 5. Keep going or convert to IUI. Keep going. Do you recommend using CoQ10 with using donor eggs? Yes. Miscarriage with PGT embryo developed SCA, subclinical subchorionic hemorrhage at 5 weeks and lost baby about a week after. Sorry. Anything else I should be concerned about besides blood clotting testing? Recurrent pregnancy loss. Acupuncture is something important. Is light cramping normal days after normal 10 days? Yes, light cramping is fine, but keep yourself hydrated. Do you have an age limit for IVF? No, we don't. Thank you, Jennifer Paxton. You're very nice. Brooklyn Kelly, a little bit late here. We're about to end, but we're at 4:00 Mountain Time, not 5. Do you need IVF medical records before coming to CNY? It is recommended, yes. What would you look at for testing when multiple FETs with donor eggs have failed? Well, definitely the uterus. I would look for the ERA, do the ERA, endometrial receptivity assay. I would do a laparoscopy for endometriosis. I would add acupuncture. Tubal reversal after 7 years being tied. I don't recommend tubal reversals unless you know the numbers. Where is the Family Building Guide? It's on the website at cnyfertility.com/resources. Family Building Guide is right there. It's free. You can buy it on. You can also buy it at Amazon if you like. But it's free. You can download it, and it's really beautiful, absolutely beautiful. By the way, shout out to all the wonderful people on the donor team, on the on-call team, the ladies on the global travel, the finance team, the folks doing consults at home, the doctors in CNY. They're amazing. The nurse practitioners, the PAs. Dr. Kiltz, of course, for creating such a wonderful organization. Guys, this is it's an amazing thing. We've got over 500 folks that are working for CNY now. We've got 5 or 6 or 7 centers, 4 of which or 3 of which do IVF. We got lots of folks, lots of people working, growing, trying to help you create families. So, we're really blessed. You're very welcome, Stephanie. And the main thing, folks, get yourselves educated. Usually every other week I do a lecture. I kind of got very busy this week. We got some visitors this week, so I haven't been able to do a lecture this week, but I will do that. So, all right. Well, thanks everybody for joining me today. It is our pleasure to educate and give you more opportunities. I mean, that's what we do. I think our mantra is access to care in the most compassionate way, and we do that. Sarasota is developing. It'll be maybe later this year. We'll see retrievals, hopefully by next year. Stay tuned. You never know what's going to happen. Well, anyway, thanks for joining me. I'm Dr. Magarelli, CNY Fertility Colorado. Wishing you all the best, pregnant thoughts, and stay well, everybody. Thank you so much for joining me.